Chief
you wanna know who they were.
radiologist.
Oh.
Chief radiologist. I
Them
don't know
folks.
if we said that already.
Chief radiologist.
Radiology.
Dosimetrists, biomed vendors, supervisors, medical physicists.
Did you send us an up-to-date one?
I'm gonna send it once I'm finished
Okay,
completely
gotcha.
with this, yeah. So before the review, I'll send the PowerPoint with the questions,
I'm gonna take a picture of this one.
okay?
Just to be on.
Cause as I go along through the PowerPoints, I am kinda adding and taking away stuff, so before the test, I will send it out to you.
Thank you.
All right, so let's get into quality assurance. So, quality assurance is a plan designed for systematic observation, assessment of different aspects of a project, service, or facility to make certain that standards of quality are being met. So, again, this definition is nicely in bold red. So that means y'all have to know it for the test. And QA focuses on people and service. Alright, so any questions about QA? Alright. So with the main takeaways from this slide, what I want you to know is quality assurance is an organized effort of the radiology staff. And the purpose of quality assurance is to provide adequate diagnostic information with the least possible cost and the least amount of radiation exposure to patients and other staff. Any questions on this slide?
The purpose of quality assurance.
Say it again?
The purpose of quality assurance is
Yes.
providing adequate diagnostic information.
Yes. So diagnostic imaging departments are responsible for promoting quality patient care. So if you see something going wrong, you see a tech sending not so quality images, you see an exam that may have been ordered wrong, it's your duty to go ahead and speak up because you don't want the wrong body parts to be x-rayed or imaged, and you don't want non-diagnostic quality images to be sent. You don't want that to happen. Because the radiologist is just not gonna come down on that one person, they'll come down on the entire department. Alright, so the Joint Commission's 10-step QA program. So the Joint Commission recommends 10 steps for each hospital in their facilities QA program. You don't really have to know all of these, but just be familiar with them because it will show up on the test one way or another. So the first one is to assign responsibility. Second one is to delineate a scope of care. You want to identify aspects of care, identify outcomes that affect aspects of care, establish limits of the scope of assessment, collect and organize data, evaluate care and outcomes, take action to improve care, assess and document actions, and communicate information across all departments. So these are the 10 steps that the Joint Commission recommends for QA programs.
So 10 steps for quality assurance.
So if I were to ask you a question on the test, I would say which one of the following is part of the TJC's 10-step process for the QA program. I might pick collect and organize data as one of the answers. That would be the answer that you choose. Alright, so the responsibilities of the QA/QC team is you wanna establish additional radiographic techniques whenever needed for your charts. That's your exposure charts, or you can revise existing technique charts whenever appropriate. Normally, this would happen if the department gets a new machine or if an existing machine undergoes major repair. You may have to tweak your exposure factors a little bit. We don't really worry about dark rooms. I really don't know of any facility that still has a dark room. So we're not gonna worry about that one. Another responsibility of the QA/QC team is the periodic quality control testing of all of your imaging equipment and your accessories. Accessories meaning thyroid shields, lead aprons, things of that nature. And some more responsibilities. Some facilities actually keep a log book, like a binder, in each of the x-ray rooms, and what's included in this log book is like QA tests, whether they passed or failed, printouts of the QC test, whether or not they passed or failed, sample images that may come from medical physicists or the vendor personnel, things of that nature. Sometimes you can find this information on like in the R drive or the P drive, whichever one the department sets aside. But mainly they try to keep it in the binder, because if Joint Commission or anyone comes around and wanna audit your information, it's readily available. The second one is very important. You wanna make sure that you keep all brochures and manuals in each x-ray room, CT room, or whatever. So brochures and manuals come with the x-ray equipment when it's installed. Those are to stay in the room, they're never to be removed. And the reason being is because a lot of those manuals are actual guides in how you perform the QC test on that particular equipment. And also when you're being audited, especially for mammal, that's one of the things that the FDA will ask for. So other responsibilities is the QC team meets regularly to discuss results of any QC tests and discuss any problems that may occur or take place in radiology. They decide on corrective action, and of course it's very important to keep documentation of all communication. And communication being, say, if the x-ray room goes down on first shift, it's the responsibility of the lead tech or whoever discovers that the room is no longer working. They put in a trouble ticket to Biomed to let the next shift know what's going on, which is called the hands-off approach. All right, so a proper QA program also helps you answer these questions. So is the scheduled exam appropriate for the patient? So if a patient comes in, they're scheduled to have a barium swallow or an esophagram, we need to make sure that that's the actual correct test that was ordered. Because it could have been that the ordering doctor wanted a modified barium swallow, which is done by speech, which is a totally different procedure. And if that's what they wanted, but they ordered an esophagram or barium swallow, and we do that, that was the wrong exam. So before any fluoral procedure, this is why you always consult with the radiologist, talk to the radiologist to make sure that this is the appropriate exam before we proceed. So let's say the barium swallow that was ordered, you okay? You
Yeah.
dying over there?
No, she just.
So if the exam was appropriate, indeed, the doctor did want an esophagram, you wanna make sure that that patient was given proper instructions before they come in for their exam, meaning you give them the instruction that they are not supposed to have anything to eat in PO at least 12 hours before their exam. If they have an 8 o'clock exam, they need to be there 30 minutes early. You need to tell them that you need to be here at 7:30. QA also helps you answer the question, are you x-raying the right patient? So again, how you can tell is you do your patient identifiers, name, date of birth. You also check the wristband, make sure that you're x-raying the correct part. And of course, did I produce the best quality image? So meaning the best image that you could get depending on the patient's condition. It never hurts to ask too many questions. Don't be afraid to go talk to your radiologist, because I guarantee you if you do the wrong thing, you will never hear the end of it. Some hospitals will probably even terminate you, just saying. And also a part of the QA process is image interpretation, which of course is done by the radiologist. So image interpretation is, did the patient's ultimate disease or condition agree with the radiologist's diagnosis? This is known as outcome analysis. So again, that's important for you to know.
Previous slides, responsibilities, you know those for the task.
Say it again.
There was the previous 3 slides, responsibilities of QAQC.
If it's not in blue or red, we ain't worrying about it. Yep. Well, because this is little information, but a lot of information, I'm trying to give you just the important things that you need to know for the class. So that way you're not clouding your mind with extra information that you really
That
don't.
you don't need. I know that's right.
Alright, so for the image interpretation, this just basically means that, let's say your barium swallow is done, image is sent, radiologist goes back to the office, he sits down to read it, he makes the final report is in the patient's chart, the ordering physician is notified, patient is notified, this is what the outcome analysis is. Meaning you're following that patient from start to finish, from that procedure. So any questions on this one? Alright. So the key thing to remember on this slide, this will probably be a true-false question. The primary goal of a radiology QA program is to ensure the consistent provision of prompt and accurate diagnosis of patients. As a matter of fact, that just might be a true-false question. So your goal as a technologist for proper QA is to make sure that you're maintaining quality diagnostic images, that you're reducing radiation exposure to patients and other staff, be a patient advocate when necessary, and CYA. If you don't know what CYA is, ask one of your classmates, because I'm quite sure they know. All right.
I looked up the dictionary. I found it.
You found out what it is?
I was ready for you.
Is it wrong for me to be hoping that she did ask? It's like,
He's like, I wanna let her know.
I wanted to say, I know, teacher.
So what is the focus of QA? You could actually
Quality
go back.
assurance.
To
Get
help
good
diagnose the
images.
patient accurately,
It's like
or whatever she was saying.
preventive.
Say it
She
loud.
just said it. Yeah.
Ooh.
Yeah, so say it.
To diagnose the patient accurately. Your previous slide definition.
He said your previous song. I know that's right.
Oh, okay.
Oh, you're going on.
Things too far.
What that says at the
Oh,
bottom.
People in service.
That's all you need to know.
okay.
That's all you need to know.
Exam accuracy is on
So again, what does QA, what is the focus of QA?
People and services.
Alright. So now, what is the purpose of quality assurance?
To
Then back to a
ensure-
couple of slides.
To ensure image accuracy and exam accuracy, patient care, aided managers, etc.
Mm-hmm. Be a
This is called
patient affidavit, whatever it's called.
Advocacy.
Mm-hmm.
Go back a few slides. Think about it.
Organize.
To ensure diagnostic images produced are of high quality and adequate diagnostic information at least possible cost.
Okay, keep going.
Organize efforts
Is it uniform?
on staff. Mm-hmm.
Okay.
Charles was on the right thing.
I'm just gonna sum it up to this because it's a lot on this page. It says It says.
So yes, ensure the least amount of radiation
Oh.
exposure to patients and staff.
Yeah, okay, it says make sure the standard of quality.
That's why I haven't, because I'm in the process of going back and forth and trying to clean up some of these PowerPoints. Cause this was PowerPoints that were already established and in place. So that's why I'm not emailing y'all the final one yet. Okay, so what agency or organization promotes the 10-step quality assurance program?
TJC.
This is the joint commission.
Yep, Joint Commission or TJC. Establishing a radiographic technique chart is the responsibility of what committee?
Say it one more time.
Establishing a radiographic technique chart is the responsibility of what committee?
QAQC.
Yep. The QAQC committee. And interpretation of an image where the patient's disease or condition matches the radiologist's diagnosis is referred to as what?
Quality
Called
assurance.
analysis.
Say it again, Veronica?
Outcome analysis.
Yep. All right. All right, so let's take a look at some images.
Necklace, nope. And, marker, nope.
As far as QA is concerned, what's going on with this X-ray?
Everything.
It's
Yes,
a
sir.
collimation.
What kind of exam
Is it supposed to be a chest?
It's supposed to be a chest.
Collimation for sure.
So what type of chest you think this is supposed to be?
A pediatric.
It's a, but it looks like an AP.
It's looking more like it was supposed to be a portable chest, AP
I don't
portable
think it's
chest.
Because there's no.
Why is it portable, AP if you understand it? Because normally
It's-
you wouldn't
it's not
take
standing.
AP test.
Well, this by
They're semi-erect.
protocol, they're semi-erect, but not only that, this is not a quality
And
image.
they're being
You
held.
should not send this image through.
Mm-mm.
Why should you not send this image through?
Because it's got artifact.
Got some
Aside from the artifacts, it's very poor exposure. Like,
Exactly.
Yeah, that too.
And
It's
also there's a
just-
tilt in the patient.
And it doesn't look like they told the patient to take in a deep enough breath if they could.
Mm-hmm.
Because 1, 2, 3,
But I
4,
know,
5, 6.
I noticed something else though.
But we have
It's the
standards.
here, their parents' arm.
Yes, you see the fingers, that
Yeah,
that's somebody's fingers holding
they
the
didn't
patient.
collimate at all. There's an
Right.
artifact up here as well
Yes.
It's creepy on this side.
in their left arm. Looks like metal shrapnel.
But it's not in the way of the
Pneumatic.
lung field, which is what you're supposed to be concentrating on. Would you send this through?
Oh,
God.
why they do that?
My glasses on.
Blurry.
So what's wrong with this one?
Spatial resolution is not enough.
Okay, definitely not enough penetration. What else is, oh Lord, that
They
didn't
took
come
that
out
X-ray
right.
from the other room.
Huh?
They took that X-ray from the other room.
See, y'all caught that. So I was like, oh, that didn't come out right. Okay, so definitely the spatial resolution is off. What else is going on?
Ain't got no marker.
No marker.
Looks like an alien here. I don't.
Kind of has like the blurred, noisy effect.
Mm-hmm.
Would you send that through?
Mm-mm.
Believe it or not, some people will.
What?
It's good enough.
Yeah.
Some people
Now,
will.
what could you see on that thing?
I can see.
Let it take.
What about
Got
this
the
one?
glasses on, I can't see a thing.
No,
What did
too
you
much
put in the
off.
chest?
Too much
That's
foundation.
unfortunate. That's what that is.
The tube is not
This
gone
is the
in
tube.
correctly.
What is supposed to be where it kind of
It should be
down?
cutting off that soft tissue.
There you go. Yep. This, I mean, aside from, well, they'll have to pull that tube back and make sure that it goes in straight.
In the right way.
But
Yeah, like,
that,
I'm not
but that's
nurse,
not
so-
your job. Your job as a tech is to do what?
Take
the image.
Hey,
The
look,
image
this
so they can see
G-tube
whether the
is
tube
not where you
okay.
think it is.
That's right.
So if this is supposed to, let's just say for the sake of argument, this is supposed to be an AP, let's just say it's an erect chest portable, cause you're checking for tube placement. Why are we cutting off
The rest.
the sides of the lungs and the ribs? Why are we doing that?
They was mad.
So at Bentob, they would say that they don't need it.
Well, that's what I
Not
was
hurt.
getting ready to tell y'all. Do not follow that model, because this is not a chest
It's
X-ray,
not acceptable.
and that's not acceptable. I don't care if they are just looking for line placement, you need to do a full chest X-ray.
Okay.
Follow the protocol.
What else is going on with this image?
No marker.
No marker. This is bad because if a patient has dextrocardia,
Ooh.
how do you know which side is what?
Mm-hmm.
So this is why you always mark your images.
Ma'am, can you remind me dextrocardia?
The opposite side.
I forget
Your organs
the
are
part.
on the opposite side, so your heart, instead of being on the left side, it's on the right
And
side.
it can go for different organs too. It's not just the
Yes,
heart.
right. And be careful, because patients with dextrocardia will try to trick you, and they do that on purpose. And then they will laugh about it. But like I had to tell one of the patients, I was like, well, it's your life, not mine.
That's right.
Well, I had a patient like that, and he was just being funny when I was with Mr. Fred. I showed the class. He
Mhm.
said, "Are my organs in the right place?" I said, "Are they?"
See? Mhm.
Are you too?
Mhm. So they will
Was
do
that the
that.
liver?
So
That
what
was the
about
liver
this
guy?
image?
Yeah. It's a
That
pretty
is-
decent image. It's just not marked.
It's not
Is it just
properly
the wrist?
positioned either.
We know
So-
Is it APAs?
So it's
Is this
it's a TA wrist that isn't properly collimated. I don't think they're positioned correctly either.
That looks like a wrist.
Is it the
It's there's nothing wrong with it outside of it not having a mark.
That makes it a good image.
But are you supposed to have like the hand or the thumb underneath it? Like
Well,
that?
this may be their protocol. Remember,
Okay.
your radiologist is the one that sets the protocol for what they want. Some radiologists may want you to get all the way up to the digits. This could be their protocol. I mean, outside of the marker, this is a fairly decent image.
Okay.
This is a good image. What
I
about
have a
the
question
little
for
baby?
this last one.
Uh-huh.
When I said PA, when I said AP, you said PA.
Yes,
But
this is
the-
a PA.
But the radius should be on the side of the thumb, right? Is that way you can say that? I always have this issue. Can you say that it's on the side of the
Gotcha.
thumb by
You
looking
said
at
AP.
this?
She said AP.
Or you said PA.
Because we don't do AP.
But she said he's wrong.
So the thumb on this
I'm
thumb
wrong.
is-
You have to defend yourself, sir.
I think fuck
Just-
it.
You can't say that unless you see the phalanges.
You mean how can you see that it's the thumb?
Yeah. Can you or can you not? Because
Yes, you can see
That's
that.
the
Because the
thumb.
radius goes with
Here.
the thumb.
Yes.
You can look at the carpal bone.
Carpal
and tell.
bone, yes, and tell, what
You
is
can
this
look at
bone
the
right
base
here?
Step forward.
You
Yeah.
can look
So-
at the
So
this
it
is
looks
your
like
thumb.
that.
phalanges
Yes,
and know
would
that
be
it's
the
the thumb.
Yes.
There's no AP wrist, only PA,
Yeah, that's right.
yes. Okay,
I heard
so what about the baby chest? Yes.
Oh, the baby.
They got that baby whole head. They need to be fired.
So aside from the teeth and the chin, the baby chin, it's a fairly decent image, but what do you need to do?
Come down some.
We don't need a
Off of this
mandible.
baby chin.
We don't need all that.
Okay, that you're
Hey.
You could, I would collimate like right up to
That chin maybe the bottom of the
this area right about the diaphragm, and lift the head up some
They're
more
not gonna be.
and collimate
And
that.
why the hands up?
This is an
Parents holding them
irregular.
up.
So if this is a baby, obviously they can't stand on their own.
Parents
So the
holding them
parents is holding them with the arms up, and they're in the upright position.
So if they had centered better, they could have collimated a little bit more accurately.
Possibly,
Okay.
but I mean, this is a PD.
Yeah. It was probably moving too.
Yeah,
Yeah.
so. But I would actually take this image over the rest of them that we've seen.
Yes.
All right.
It's got a marker too.
All right, so another part of QA is Alara and nosocomial infections. So Alara, of course, is
as low as reasonably.
All right, and again, we wanna make sure that we minimize the amount of radiation exposure to other staff members and to the general public. All right, and, of course, time, distance, and shielding falls under OLARA, so what about nosocomial infections? What's nosocomial infection?
The ones that.
That's an infection obtained inside a hospital
In
setting.
the hospital during the treatment.
So right what Charo is doing, make sure you wash your hands, make sure you, wear your PPE, which is your universal precautions. You will see the surgeons, there's a reason why before they go into surgery, they're scrubbing basically an inch or two past the elbow, all the way down to the fingertips,
Walking
to
in
make sure
wet.
they're not carrying any infections into that surgery suite. Okay, cause a lot of infections happens while the patient is in the hospital and during surgical procedures. So you wanna make sure that you try to prevent these, infections at all costs.
Is it raining outside?
So that's considered surgical asepsis, right?
Say it again?
That's considered surgical
That's,
asepsis?
that's one of the infections that you can get. from
No,
surgery.
I'm saying asepsis.
Asepsis, yeah.
Like, that's
Mhm.
the surgical asepsis?
Yes.
Okay.
Mhm. So, QA, it is the ability to identify potential risks to patients, employees, and visitors. It also involves the establishment of various processes to accomplish specific departmental tasks. So again, you wanna make sure that you have your procedure manuals in your rooms or in every department. You wanna keep track of your data collections, scheduling and routing of patients, education of your personnel, communicating with other departments, and administrative responsibilities, which that basically falls on the management.
Ma'am,
Mhm.
but I was, the QA doesn't deal with the quality of the images and all that, for example. It is only
Quality.
it's saying potentially the risk to patients, employees and visitors. Is that what the QA is only looking at, taking care of the environment and everything?
No, quality assurance images still falls under that.
But
because
we don't
again,
have one of
if
them
you-
saying that, no?
Hmm.
One of these is not saying that, not only one is saying that.
Well, this is wrapping up QA in summary, but what did we just do here? What was that? That's what we just did. This still falls under QA, because if you are not, if you don't take the proper x-ray, say like for the wrist, this is not marked, and you send this through, the radiologist will tell you, call that patient back in, cause I want you to make sure that your marker is on the image, which means you're now re-radiating this patient, just because you missed the marker. That falls under quality assurance, because again, what do you wanna do? You
Yes,
want
Lord.
to lessen the amount of radiation exposure to the patient. Alright, let's see what else we got. So, I think this concludes QA, I believe. Yes, it does. Hallelujah. Alright, moving on to QC. Let's see how much of this we can get done. So, quality control. It is the comprehensive set of activities that monitors and maintains systems that produces a product. So in this case, our product will be the image that's produced from the X-ray machine, the equipment. So QC measures are taken to ensure that radiologic procedures are performed safely, appropriate for the patient, performed efficiently, and high-quality images are produced. And QC focuses on instrumentation and equipment. The only takeaway that you need to know from this slide is quality control begins with the imaging systems and it concludes with a dedicated analysis. And from this slide, you wanna take away from it that quality control focuses on the strengths of the images, which relies heavily upon the equipment working properly. So again, your image can only be as strong as not only you as the tech, but also your equipment. So any questions on those two slides? All right, so there's
What's
three.
in blue, what's in blue?
Yep. So the three major categories of QC testing: acceptance testing, routine maintenance, and error maintenance. So for acceptance testing, so anytime new equipment is installed or existing equipment undergoes a major repair, it has to undergo an acceptance test before you can use it. You cannot use the machine without it undergoing an acceptance test first. For example, Strawberry just got a brand new mammal machine. They are still not able to use it, which means they're not able to schedule patients because they're waiting for the medical physicist to do this acceptance testing.
Is it gonna be a while before they come, or how does that?
I believe they're gonna try to open up by the beginning of next month. I believe so, yeah. Cause they were operating under a 2D machine for the longest and they finally got a 3D machine. Yeah.
They're using that TSRT money.
How about that X-ray room?
Yeah, I thought
Yeah.
that's what you was gonna say. I really did.
And you know what, I asked Biani, I'm like, how did they leave you out of the upgrade? Because I believe you and Gio needed it the most.
Yeah.
Oh, yeah, oh,
Yeah.
yeah, all
Yeah.
these are upgrade.
Yeah,
That's cookie table for me.
all right. So acceptance testing is performed by the vendors, but again, if I'm Philips and I'm coming in to sell you my machine, I install my machine. Of course, I'm gonna tell you, yeah, everything is working fine, it's good. You don't have to worry about testing it. And once you start using it, everything is not fine. So with this acceptance testing, vendor personnel is removed out of the equation. Acceptance testing is done by the designated technologist, which is most likely your QC technologist, the medical physicist, and or biomed.
Mr. Key? Are you ready, Mr. Key?
So remember that. Acceptance testing has to be done by someone other than the vendor personnel or manufacturer representative. So either your QC technologist, medical physicist, and or biomed. Most likely, it'll be your medical physicist that does this. So any questions on acceptance testing?
You said, for designated technologies, you said QC technology.
Whoever is the designated QC technologist.
So when we say designated technologies, it is not the tech using this.
Well, everybody will be using the machine, but the QC technologist is responsible for QCing the equipment.
So last question.
Mhm.
You know, for like the clinics, like Strawberry or
Mhm.
like the other, would they be the QC because they're the only ones there?
Yeah. Like at Bentab or LBJ, they will probably have a designated tech. That is their QC technologist. But at the clinics, because they're by themselves, like with me, when I was working in Connecticut in mammal, I was the only mammal tech. I was it, the end all, be in all, end all. So I had to not only do mammals, but I also had to do the administrative side of it. So which meant I had to do all the QC testing.
Sounds like a lot.
All right, so routine maintenance. So this is to ensure, of course, that the equipment is working at the departmental standards and expectations. And it's done so it can catch the problems before it becomes radiographically apparent. So while you're doing routine maintenance, if you happen to notice, say, like an artifact that pops up on your image, you can be like, okay, well, let's take care of this problem, see what needs to be done, call Biomed. They may have to get the vendor personnel in to rectify the issue. But all equipment undergoes some type of routine maintenance, so that way you can try to prevent any errors in the future. And this can be performed by a designated technologist, again, which is the QC technologist, the medical physicist, or it can be done by the vendor personnel. Cause like for mammal equipment, every year, they call them field engineering technicians from Hologic would come in and do routine maintenance on the mammal machine. I would have to close the schedule, cause that's pretty much an all-day thing.
Does the tech have to stay there while they're doing this?
Mhm.
Wow.
Mhm.
But you're just paid to just hang out at that point, or do you have to actively be involved with the?
You don't have to actively be involved, but if there's any issues that they come across,
Mhm.
they'll let you know, like what's
And
going
then you
on.
document
And document it, yeah, cause again, that needs to be kept in the logbook.
Okay.
And also, if you're doing other, you might be helping out in X-ray or doing something else, you know, but you do have to be there.
Okay.
So for error maintenance, errors are detected by poor equipment performance or poor quality outcomes. So again, if your artifact shows up on on your image and you continue to use that cassette or you continue to use that detector and you see that artifact constantly popping up, that's it that you need to call because there's an error maintenance somewhere. Call Biomed or you might even have to call a vendor personnel. Alright, so any questions on the three categories of QC testing? Acceptance testing, routine maintenance, error maintenance. Alright, so the medical physicist role. So while QC requires a team effort, it is primarily the responsibility of the medical physicist. So when the medical physicist comes in, most of their QC testing is done annually, unless a new machine is installed or an existing machine has been repaired. They are responsible for overseeing and implementing a QC program. They are the supervisor of the QC program.
Are they based like in the hospital or they're just wherever?
Sometimes they're based in the hospital and sometimes they might be based somewhere else. Alright, any questions on this slide? So remember, they're the primary person that is responsible for implementing and overseeing the QC program. Alright, so the takeaway from this slide that you need to know, we're gonna scratch this part out, so don't worry about this part in the center. Just this bottom part is what I want you to know. So accredited organizations such as Joint Commission or CMS, which is the Center for Medicare and Medicaid Services, and yes, they do come to hospitals.
So CMMS?
Nope, just CMS.
Okay.
They will not place their seal of approval on any facility that does not have a QC program in place. So remember me telling y'all last week that Joint Commission requires a QA/QC program to be in place at any healthcare facility, because if not, they're not accrediting that facility. It's the same thing. And with insurance, that means insurance companies will not pay for any imaging exams as well if there's no proper QC program in place. Which basically means the hospital will eat that cost, which means they will take that cost out of radiology's budget. So this is the only part that you need to know, don't worry about this. Alright, coming down to the end. So somebody tell me what is the definition of QC?
Monitoring, maintaining, equipment, tools.
Instrumentation and equipment.
And what does quality control begin with? Think about that slide. I think that was like the second slide on the quality control.
Imaging systems?
Reactive process to evaluate quality. Let's see what you got.
Against with imaging system.
Implementation that exists.
With the analysis.
Yep. So quality control begins with imaging systems and it concludes with dedicated analysis. That's the only thing from that slide that you need to know. And on the test, if I was to ask the question, which I probably will, this is exactly how it would look. So what are the three major categories of QC testing?
Acceptance,
Error, acceptance, testing, routine maintenance.
So while QC is a team effort, who's the primary responsible person? Medical physicists. And true or false, accrediting organizations will place their seal of approval on the healthcare facility with or without a QC program. Y'all was paying attention. Feel so loved. Alright, so we're gonna stop here, cause we got a few more slides to go. So we'll cover those on Thursday. I will email out the syllabus with the updated dates of when everything is due, so everybody knows what's going on and what's due. Alright, any questions? Yes.
So, when Cody and I were at TSRT last year, we had a chance to talk to this vendor tech guy. I don't know, but he talked about phantoms, and when he was talking about them, they were like for learning purposes as well as inspection. So, like, let's say he had a fake arm, you would sit that on a detector, X-ray that, and you expect the image to come out a certain way. Is that like what you're talking about here?
With this one here, that's a different one. That's the test that they solely do. For
Okay.
the vendor personnel.
Okay.
For this one, we'll go over it Thursday. For this one, it's, if you ever see your tech doing the QC, that is that silver plate.
Yeah.
What they'll do is open up the collimators all the way. They'll slide that silver plate right over the collimator light, and they'll make a series of exposures. Because what they're checking for is the density
Okay.
in each exposure.
Okay.
Yeah.
So it's like a filter.
It's that it looks like a sheet of metal. It just slides over the wall. I don't know. It just slides over the column.